I'm from SUNY Brockport. I'm an associate professor in the Department of Healthcare Studies, where I teach specifically in our Alcohol and Substance Abuse Studies program. And I'm joined by two of my colleagues today, who I'm going to have introduce themselves in just a moment. I'm starting off on slide 1 for anyone following in alternative formats, which contains the title of our presentation today. We're going to present some information about what we've done at SUNY Brockport and then hopefully engage you all in some discussion and exploration. So our title is Leveraging Accessibility Committees to Proactively Address Full Physical and Digital Inclusion. And that's followed by my name and my colleagues' names. And on this slide as well is the accessibility symbol with the blue background and person in white using a wheelchair who appears to be in motion. So next I'll have my colleague, Jen Ashton, introduce herself. Oh, let me also just provide a description of myself. So I am a mid-40s white woman and I have brown curly hair. Jen, would you like to go next?
Yep. Am I here? Can you? You can see me now? Okay. So hi, my name is Jennifer Ashton, and I'm in the Department of Education and Human Development. My pronouns are she, her, hers. I am a white woman in my 40s, mid-length brown hair, glasses, light blue shirt, background cool deer. What else was I supposed to do? That's it.
And Milo?
Hi, everybody. My name is Milo Oburn. I am also from SUNY Brockport. I'm the chair of Women and Gender Studies, and I am currently our coordinator of our Disability Studies minor. My pronouns are they, them, or he, him, and I am a white transmasculine person, mid-40s, glasses, and short hair.
All right, thank you. So as I mentioned, we're going to start off with some information about our Committee on Accessibility and some of the work that we have done at SUNY Brockport. And so I'm gonna present the first few slides and we're gonna kind of pass some of the content back and forth between the three of us and then engage you all in some discussion, we hope, about how some of these issues are addressed on your campuses and some of the work that we might all engage in the future. So how do I flip this slide? There we go. So our committee is currently called the Committee on Accessibility, and I just flipped to slide 2. And so this slide is titled Committee on Accessibility Origins. So this committee that we have at SUNY Brockport started off as a faculty learning community. And on our campus, these are run out of our Center for Excellence in Learning and Teaching, and our groups of faculty and staff, sometimes they get together around a particular topic for the course of the academic year to explore. And so this FLC occurred in the 2014-2015 academic year. And I called it Disability Studies Faculty Learning Community when I submitted the proposal, but I actually didn't know what disability studies was at the time. So I was kind of using that term incorrectly, I subsequently learned. But the idea had been to get together people at our college that were engaged in work around disability in some way, whether that was in their teaching, in their research, in their advocacy and service work, right? Whatever context that meant for them. And then since its creation, I've certainly learned more about disability studies as a field, and we have have engaged in some work around that, which we'll discuss in a few minutes. So this was one of the FLCs that was approved for the year, and as I mentioned, really contained faculty and some staff who were engaged in work around disability in some context. And we hope to collaborate and kind of share information about, first of all, what we were all doing and how we might work to make our campus more inclusive. So we were quite a productive group that first year. We put on an ASL class for faculty and staff. We also had a guest speaker. And so we were encouraged by the director of the center at the time to consider proposing to become a more formal committee on our campus. And so we created a proposal that we presented to our provost in the spring of 2015, and were granted permission and a small budget to begin that work. And so we have continued that since, and we'll talk more about some of the things we've done in a minute. That proposal, we used data to try to justify and provide a rationale for why the committee should exist, and also why we should be given some financial and administrative support for our work. And so in large part, we based that proposal and that justification on some data from our recent campus climate survey at the time. I should also add that at the bottom of the slide is a graphic with figures of people of different rainbow colors, one of whom is using a chair, and it appears to be people of different heights. Or characters, I should say, of different heights. All right, I'm going to flip to slide 3 now, which contains a brief summary of some of those campus climate survey results that we used to try to provide a basis for approval of our committee. And so, like many campus climate surveys, this project explored a number of different areas on our campus, a number of different aspects of identity, and how people felt included and treated at Brockport. And so of the people who reported experiencing exclusionary, intimidating, offensive, or hostile conduct on our campus, I listed some of the results. And so 40% of those respondents were people with who identified as having mental health or psychological conditions of some kind. About a third, or 34%, identified as having multiple forms of disability. Again, about a third, or 32%, reported physical disabilities, 24% learning disabilities or conditions, and then 24% of people without disabilities also reported experiencing this kind of exclusionary conduct or hostile conduct on our campus. So it clearly indicated that individuals with disabilities were experiencing these more frequently than people who didn't identify as someone with a disability. I just flipped to slide 4, which is a continuation of the results of that 2014 campus climate survey, which is indicated in the title. Another area that was explored was which areas of the campus were reported to be most fully accessible. And we included some of the results here. So at the time of this survey, the student union was reported to be fully accessible by 57% of respondents. Restrooms were reported to be fully accessible by 55% of respondents, elevators by 53%, and the website by 56%. I should also note that this is based on people's perceptions of accessibility, right, rather than the areas being actually fully accessible. Right. And the survey further asked people to note specific areas of concern. And some of the areas that were most frequently reported were parking, walkways, ramps, and elevators. Okay. And so this just gives you an idea of some of the data that we use to frame our proposal for a committee, as well as some of the activities and work that we have engaged in. I should also note, I didn't include this specifically in the PowerPoint, but when we started off, we were actually called the Committee on Disability and Access. And then we had a name change just about 2 years ago under the guidance of our Chief Diversity Officer at the time. So now our current name is the Committee on Accessibility. And moving to slide 5, the title is COA-membership. So we use COA as our little shortened version of our name. So we included this slide just to really show you the current composition of the committee. We started off as an FLC, so we were primarily comprised of faculty in that first year as an FLC before we became a formal committee. And since then, one of the things that we have done is really intentionally and actively recruit members from different divisions or sectors of the college that we felt needed to be at the table or could be critical in our activities and decision making. So for example, we have 4 representatives from our facilities staff who attend our meetings and can assist in a variety of areas. We also have a counselor from our counseling center, some of those things. So our current composition this year was 18 faculty members, And these came from a variety of departments, including biology, education and human development, English, healthcare studies, kinesiology, sports studies and physical education, nursing, psychology, recreation and leisure studies, social work, and women and gender studies. Okay. In addition, we had 14 members who were in positions that were identified as administration or staff. We also intentionally recruited a member from human resources. I mentioned our facilities staff members. We have representation from the library, from our student accessibility services office, our office for diversity, equity, and inclusion, residential life and learning communities, the counseling center, academic systems and instructional support, which is the division at Brockport that oversees website and course accessibility, environmental health and safety, and also college communications. So we have members from a whole variety of sectors across the college. And then each year we also seek out student representation. For 2020 to 2021, we had 3 graduate students that participated from programs in counselor education and in education and human development. And we also had one undergraduate student who attended meetings and was a representative of the Brockport student government. Which I should also note that we do have members of the committee who identify as people with disabilities. Okay, and next I'm going to turn it over to Milo for the next few slides.
Thanks, Jess. So this is slide 6 that we're on. It's titled Committee Members, who we are and what we come with. And there's, a lot more, I think, to say about this than probably what's already on this slightly over full slide. But I wanted to add a little bit to what Jess has given us in terms of where people are coming from, because it's not just the campus location or even identity location where people are coming from, but kind of assumptions that people came to our committee with and the kinds of conversations, really productive conversations, I think we have across those perspectives. I think I can say with confidence that we do not all share an understanding of what disability is, what ability is, what ableism is, what accessibility is. And those are really key issues for forming a productive collective that's going to make some change towards anti-ableist work on campus. So as a committee, we are composed of a bunch of different people, but I would put us into sort of 3 categories, and there's a lot of overlap between these categories as well. There are faculty and staff with disabilities and students. We have students on the committee now as well, though we didn't when we started. Practitioners, people I'm calling practitioners, so people whose work focuses on support of or working with people with disabilities, and disability studies scholars and theorists whose work focuses more on teaching disability studies. So again, that's not to say that there aren't people with disabilities who also, are practitioners or theorists, but that these 3 perspectives, it was clear to us when we started that we were coming with different kinds of understandings about what our work was and how people understand or respond to disability in our society. What we shared, I think, was that we all came with an awareness that at Brockport, there was a problem with limited accessibility. I remember that first time that Jess got us together in the faculty learning community, it was just everybody being like, these are the things that, we've been frustrated about and we want to see change. And we also came with an understanding that there were inequitable structures, right? That it just wasn't just the individual curb cut, but that there were broader structures we wanted to address, and that there were beliefs about ability and disability that needed to be addressed as well. Some of the differences we came with were just understandings about maybe how to approach those issues, what kinds of things would be most effective in moving forward. So a couple of examples. In one conversation, we were talking about a fundraising event. One of the activities at the fundraising event, which was related to working with young people with disabilities and accessible sports. So one of the activities involved participants wearing a blindfold and playing one of the sports. So this was a sport that you could actually play blindfolded, but it overlapped a little bit maybe with our sense of sort of trying on disability as an identity. And so we had a good conversation about whether this was something that encouraged sighted people to imagine that they could know what it was like to be blind by putting a blindfold on, right? Which would be a very ableist kind of exercise, versus allowing people to participate in an accessible sport, a sport in which some of the members, if they were sighted, or had higher vision, would wear blindfolds. And so we got to kind of talk through what that meant for people who identified as people with disabilities, what it meant for people who were doing work around accessible sports. And, you know, I think came to a better understanding on both sides. People first language versus identity first language, right? So people with first language is people with disabilities, identity first language is disabled person. And many of us were coming with pretty strong beliefs about how either we ourselves wanted to identify or we wanted other people to identify the kinds of language that is appropriate to use. And so I think we've all gotten a lot better at kind of recognizing what language other people use and reflecting it back to them, and also understanding why somebody might feel very strongly about person first language or very strongly about identity first language. So that's all to say that one of the outcomes of our work has really been a growing understanding across these perspectives about what anti-ableist work and accessibility can look like. And I think that's very different from what many of us came in with. You mind going to the next slide, Jess? All right, so this is slide 7 and it's titled Working Definitions. And this actually is a slide that came out of a workshop that we put together in another committee to try to raise awareness on campus about ableism as a form of oppression. But these are definitions also that kind of came out of our work on Committee on Accessibility. So the first one is accessibility, and we have this very pretty broad definition. So our definition for accessibility is the level of inclusivity of any environment, physical, learning, social, etc. This definition has allowed us to do some work that falls outside of specifically supporting people with disabilities, although it's inclusive of supporting people with disabilities. So for example, the committee did some work on gender neutral bathrooms and access to bathrooms in general. And bathrooms became a site where we were talking about accessibility on multiple levels that included physical accessibility, but also included gender accessibility. And then our definitions of ableism, we've got 2 here. So the first is a dictionary OED definition, and the second is a scholarly definition. So the dictionary definition, which I think is sort of our, you know, working day-to-day, we show up, we think about this, definition is ableism is discrimination in favor of able-bodied people, right? So just looking for ways in which our campus on any physical, social, learning level is discriminatory, providing privileges for able-bodied people that are not accessible to people with disabilities. We also have this scholarly definition, and I'll read that a little more slowly. It's got a few phrases in it. So the scholarly definition is the implicit belief that disability makes one less deserving of respect, a good education, membership in the community, equal treatment, equality before the law, opportunities to live independently, and to have self-fulfilling lives. So the thing I like about this stuff, well, there are 2 things I like about this definition. One is it gives us some very specific places to look for where ableism manifests that we might not always look for, right? If we're looking only at physical accessibility, we're not thinking about sort of the broad range of what makes something, you know, a good education. How are people feeling respected? Are they being equally supported, even legally, you know, on our campuses? Are they feeling that they're more or less, you know, dependent or independent than other campus community members? And then the other thing besides sort of those specific places in which ableism manifests is that it has the implicit belief in it. So we've been trying, I think, as a committee to balance making sure we do material work. And we're going to discuss some of the things, many things that the committee's done that have been really impactful. So things like making sure a building is actually physically accessible if you're using a wheelchair, right? That continues to be part of our work and an important part of our work. And then sort of balancing that with what are the implicit beliefs that created a situation in which it took people on a committee repeatedly reporting something in order to get it changed, right? What are those implicit beliefs that we continue to hold, including, many of us on the committee that we're unaware of, and how do we start to dismantle those internalized beliefs? I'll go forward, Jess. All right, this is slide 8. It's titled COA General Information, but it's really a slide that has our mission statement on it. So I'm going to read it, and then I'll talk a little bit more about kind of how this mission, I think, balances what I was talking about in the last slide. So the mission of the Committee on Accessibility at SUNY Brockport it's got 3 parts. 1, to ensure accessibility, physical and digital, for all students, faculty, and staff for academics and campus life, right? So this is physical and digital accessibility, really looking at how our campus is physically constructed, and then looking at how our online courses, website, et cetera, is constructed. 2 is to increase awareness related to the needs of individuals with disabilities on campus. And 3 is to develop coursework for students to study disability. And you can almost see how when I said the people that make up our committee are practitioners, people with disabilities, and disability studies scholars, how our mission almost like came into 3 parts that were largely informed by those different people. So the first one is a little bit more practitioner related. How do we change campus to make it accessible? The second one is really thinking about not only accessibility needs, but disability as a social identity. How do we support students with disabilities? How do we support faculty and staff with disabilities? What are those needs really? And then the third one is a little bit more related to critical disability studies and how we introduce that as an accessible field of study for our students on campus. I like the way that this mission functions because, again, it allows us to maintain a focus on disability rights and disability justice. So we don't, even though wasn't a big fan of changing our name. I'm fine with it now, and I like Committee on Accessibility, but I was actually sad about losing the word disability out of our name because I didn't want us to lose sight of the fact that we had really started because we felt like we needed to center the needs of people with disabilities, right? And talk specifically about how ableism was functioning on campus. And we want to think about accessibility as something that is important for everyone and serves all. And that came up in our previous presentation as well, right? About universal design, that it may really serve the needs of people who've been historically marginalized because they have disabilities, and it's useful for everybody. And so this mission, I think, allows us to both maintain that focus and think about accessibility and ableism as things that impact everyone and have a broader reach. All right, I think, am
Thanks,
I
Mel.
done now?
Yep, I think let me just change this. The next few slides, we're going to go through some of the things that we have accomplished over the last several years, some of the work we did this year, and then some of our future plans. So Jen's going to start us off on slide 9.
So since we've been functioning since 2014, 2015, we've had some major accomplishments along the way, and we've had a series of awareness events and workshops and guest speakers. And the image that you're seeing here on slide 9 is, you'll see Jess and myself in the middle, and 2 other a former staff member and faculty member, and one of our guest speakers, Bob Lujano, who identifies as a man with a disability. He's a wheelchair user, and he was one of the main characters in the documentary film Murder Ball, which some of you may be familiar with, but we screened Murder Ball for the campus community, and we brought Bob in to come in and facilitate the discussion on it. And that's kind of one example of some of the things we've done along the way. Similarly, we had a local lawyer and activist named Stephanie Woodward, who some of you may know through state and national work. She came and she did a similar thing, walking us through a discussion after we viewed Me Before You, which was another more recent film. And so what we're doing is we're trying to bring in people to start conversations. And so some of these come out of, hey, I've used this material in my class. I'm familiar with this, or maybe maybe this is an issue that we've learned from our campus climate study that we would like to bring in some education from it. So this is a constantly evolving list of things that we decide to do at any given time. And it does evolve from the committee members. We've done campus accessibility explorations, and this is a great example of how we are learning as a group. As Jess and Milo have both said, Jess said we started with the name of disability studies, and both Milo and I got really excited because we're both disability studies scholars. And I thought, wow, this is fantastic. We're going to have a really critically theory-based disability studies faculty learning group. And then it was like, wait, we've got some learning to do. And so what we've been doing all along is having these conversations, and this topic of the campus accessibility exploration. This was brought up in our committee as, hey, can we do a simulation? And that's when a couple of us took a deep breath and had a really careful but possibly challenging conversation about the problems with simulations, as Milo had explained earlier, and how we might be able to understand access through an exploration, not trying on a disability, but seeing, what is it really like to get from point A to point B if you were in a wheelchair at the college? Not focusing in on what it's on assuming you know anything about what it means to be a wheelchair user, but saying, look at how our campus is or is not accessible. So these conversations happen in the meeting time. They're brought up because we have people who are at various points of understanding about ableism, about disability and access. And about any of it, because some of the people have chosen to come in because maybe they were asked or voluntold to join this committee, or they have a vested interest at various levels. So we have all of these people here getting together. And so our accomplishments and our events are all organically kind of derived and evolve to a point where we get to this place where we're really excited and we really feel that it represents the values of the committee. We've also put stickers on push pad doors and elevators, I believe, all across the campus. And these are saying, well, I believe and these have evolved actually as well, but they're saying, does the door not work? Call this number. And I believe we're getting the QR codes onto them now, so we've evolved into that, and we've changed the coloring on them. But basically, before then, these accessible entry points, elevators and doors that are assisted, what do you do if you approach the door and the elevator and it is not functional? Do you simply not go to class? Do you have to, take a 10-minute roll around or walk around? So we have increased visibility and discussion across campus about how we have these points of access that can be points of barrier. And so our accomplishments, they kind of evolve. They evolve as we have these conversations in and amongst ourselves. The cast of our committee changes from year to year, but there are some people who this has become a valued and important part of their work at the college. So we are constantly, learning from each other and raising our standards for these accomplishments in these events, because at no point does anyone say we're the arbiters of all that we know, of all there is to know about ableism or anti-ableism and accessibility. It's, I have this piece and you have this piece and you have this piece. And by maintaining this collegial environment, we're just constantly evolving that mission, even from the few slides ago, to be more reflective of what it is that we really want to do. So it's a long way to say our accomplishments are evolving just as the committee is as well.
Thanks, Jen. I am up for slide 10, which is also titled Major Accomplishments and then Roman numeral 2. So I mentioned this earlier, but one of our other accomplishments over the last several years is offering American Sign Language classes for faculty and staff. We do have American Sign Language classes offered, for credit-bearing courses offered at Brockport, but they're only for undergraduate students. And so this is another need that we identified that could help improve the inclusiveness and welcoming nature of our campus community is having more people that had some basic ASL skills. And so we have hired instructors to teach these 8-week typically classes for faculty and staff and graduate students to participate in. We haven't done them at all during the COVID era, and there are going to be potentially some challenges in terms of our funding of these classes, but this is certainly something that I hope we'll be able to re-implement once we are more in person again. We have also successfully obtained some grants through committee work. And two of the major ones that I've included on this slide are the Investment Fund for the Future. This was something that was implemented at SUNY Brockport specifically, where employees could apply for funds for different campus initiatives. And so the Committee on Accessibility applied for funds for everyday wheelchairs for campus events. Historically, Brockport has had wheelchairs available for events like commencement, and they have rented them from outside companies. But we recognize that there were some barriers there in terms of continuing that process, both in terms of attitudinal barriers, as well as just not having the structures in place to make that consistent across campus events. And so we were able to purchase I think it's 10 everyday wheelchairs and use them for events like commencement, our diversity conference. We've made this year a couple of chairs available for pool testing, in case someone needs to use one, so that these can be more of a part of our accessible event services, if you will, on campus. We also received a quality of life grant from the Christopher and Dana Reeve Foundation to purchase 5 sport wheelchairs. We have applied to this grant a couple of additional times, but we're not successful in getting additional sport chairs yet. But we're hoping to either reapply to the Reeve Foundation or pursue some additional grant opportunities. The long-term goal here is to have perhaps a wheelchair intramural sports program on campus. But these chairs, the sport chairs, are also used in classes, particularly in some of the classes in the Recreation and Leisure Department, which has a therapeutic rec program, and in Kinesiology, Sports Studies, and Physical Education Department that has an adapted phys ed program. And there are also some everyday chairs that are owned by that department, as well as one of the student clubs that are used in some of the other activities. But the everyday chairs purchased for the grant are specific for campus events. So this is an area, as Jen mentioned, as we continue to evolve and expand, that we hope we'll be able to continue to expand the availability and use of those sport wheelchairs. And then similar to what we're doing today, thanks for having us. We've also presented a bit about our committee work at some conferences over the last several years. I presented at the AHEAD conference a few years ago. That's the Association for Higher Education and Disability. And we've also presented at the SUNY Diversity Conference. I think that was in 2017. And now I'm going to turn it back to Milo for the next slide.
Thanks, Jess. Okay, so we're on slide 11. This is major accomplishments 3. At the bottom of the slide, there's an image of a whole bunch of people smiling at the camera. That is our Brockport wheelchair basketball team with Rochester Wheels basketball team. So on this slide, we have 2 points. One is the disability studies minor, and the other one's about collaboration. So I could talk about the disability studies minor for days. I'll try to keep it relatively short. This was one of our goals pretty early on. It may have even come up when we were a faculty learning community. And we started out with this small subcommittee of a few of us sort of trying to figure out, like, how could we do a minor in disability studies? As Jen mentioned, she and I are really the people who do critical disability studies currently at Brockport, which doesn't mean that people don't incorporate it into their work in various ways. But in terms of faculty who teach courses specifically on critical disability studies, we're working with a relatively small number of people who've been trained in that area. However, we have like a great adapted PE program, and our Rec and Leisure Department has courses that address access for people with disabilities. So we have that kind of practitioner piece built into some of our pedagogy without necessarily all of those courses having a critical disability studies lens. So what we ended up doing was creating a minor that had 3 required courses that would have a specifically critical disability studies lens. And then allowing students to take their 3 elective courses from a wide range of other options. So they can do ASL, they can do something in adapted PE, they could do something in like developmental psych, which might really not have a particularly critical disability studies lens, but then we ask them to bring that lens to the other courses that they're taking. So it's interdisciplinary. It's also sort of theoretical, maybe, meaning that they may have to bring their insights from their required courses into other courses about working with people with disabilities, and maybe even critique some of the content in relationship to their critical disability studies lens. It's currently housed in women and gender studies, which is part of the reason that I am coordinating it, because I'm also the chair of women and gender studies, but it really makes sense there. In a lot of ways, women and gender studies is an interdisciplinary major and minor. And so we're already working across departments in that way. And obviously also looking at systems of oppression and identity positions. In addition to it being housed in women and gender studies, it's also still continuing to be supported by the Committee on Accessibility. So we really have a huge amount of support for this minor, which so far has cost us nothing. I mean, we already had the faculty, we had the classes, it was really about putting them together. The biggest investment, I would say, is the labor of advisement right now. We went from no minors, because it didn't exist 2 years ago. I just checked our Blackboard numbers, and not all these students are necessarily registered for this semester, but we have 38 users in that Blackboard. So there are at least 38 students who have declared a minor in disability studies, whether they're currently registered in a class or not. And that's a big growth. So that's very exciting. And it seems to be really of interest to students across many different majors. And it's also attractive to students with disabilities, which has been really wonderful to have people in critical disability studies classes who themselves are sharing their experiences and their knowledge from their own embodiment as well. And then the second thing on this slide has to do with collaboration. So consistent collaboration with facilities, parking, et cetera, to address accessibility issues on campus. This is a huge win, I think, and like gain for us as a committee. And I want to like give Jess a lot of credit as the chair of this committee for creating relationships across campus that did not exist before. So as a faculty member, I have worked with professional staff in various areas, since pretty early on, coming to Brockport, trying to do various sort of social justice related things. I have less frequently worked with people more on the operational side, right? So facilities, parking, the system just isn't built to connect us. It's not, we don't end up on the same committees. Our hours aren't the same. When we can come to committee meetings is not the same. The ways we report to people is not the same. The kind of expectations for our jobs are not the same. So this committee has actually been the place where I have worked with more people in different locations on campus. And honestly, more people across different class backgrounds than any other thing I've been involved with in higher education. So that's like wonderful for kind of forming community. And then the practical piece is that now if we see something, instead of being like, well, if we report to facilities, our facility is going to feel like we're, faculty who are complaining about this thing that's really hard for them to do and keep up on, like we have a good relationship. So they know we understand that they have a limited amount of resources for things. And, and we know that they understand that we have really good intentions and are trying to help and support by pointing things out or finding things that, somebody else might not notice. So if somebody is repeatedly parking in an accessible spot and does not have an accessible tag, it might be something that parking, wants to know but doesn't know, and is important for either getting that person a tag if they need one, or making sure that that space is actually available for somebody who needs it. I don't know, Jess, if you want to add anything to that slide too.
Yeah, I would just say that in case anyone's thinking about forming a committee like this or expanding a committee like this, I see a big part of that as being like having the people in the room too. I mean, there have been some facilities issues that have been addressed like right in the meeting. One that comes to mind is we had some construction on campus, and a committee member had raised that the facilities staff had been using spray paint to kind of indicate some areas where pedestrians should walk. And it was painted green, I think it was, on the Brockport colors are green and gold. So it was painted green on blacktop. And so this committee member raised that that wasn't very accessible for people with visual impairments. They might not see that contrast. And so there was a facilities person in the room who said, would yellow be better? And other members were like, yes, that would be great. And so it was repainted that afternoon, right? It was, and another very recent one that comes to mind is a concern was raised about some of the forms and the language in the forms for people requesting accommodations for teaching, for online teaching particularly. So this got raised in our meeting as a discussion point, and our human resources representative then spoke to the human resources department about it. And now we're having this collaborative meeting and process of looking at that language in that form together. So kind of as Milo said, I think some of that collaboration didn't exist, at least didn't exist as collegially maybe as it had existed as it does now in the past. All right, so next up, I think, is Jen.
So, so this year it's been a challenge. We went remote over a year ago, as did everyone else here. But we've maintained our work. We've continued to bring guest speakers and workshops and events. So we've had Chris Hildebrandt do a discussion on representation in wheel life. He's a wheelchair user and kind of walked us through his narrative. JD Flores. JD Flores is a local, regional, national, international activist and speaker on disability. And she has moderated a couple of times with us a discussion on the documentary Crip Camp that was recently nominated for an Oscar award. And so we were able to do these kinds of things by bringing our speakers in remotely. And in doing that, we learned some really interesting things. We learned that our participation increased. We learned that it was a lot easier to bring in our speakers, particularly if our speakers had disabilities, to have this through Zoom. And we learned that there are some really key benefits to doing things in this slightly different way. And I think one of the things that Jess and I are going to continue our work on is how do we preserve these things? How do we maintain these things? One of the things that gets me going is, well, and as Jess has already said to our committee, she plans on having some sort of a remote access to the meetings because of physical accessibility. And that's something that we realize that for some of our committee members, it is easier. For a variety of reasons, maybe not even just disability, but for a variety of reasons, to have these meetings available remotely, have our lectures available remotely. Does that mean everything goes remote? No, but we don't know that yet. We're still learning and evolving, kind of as we've talked about. But we've still been really productive. We had a remote panel of students from Brockport who identify as disabled. And this was really, it was a really great experience because you're seeing disability pride. You're seeing students who choose to come out to the public and say, I am a disabled student. I am a fantastic human, but these are some of the things that being here at this college creates for me, whether it's physically or with my classes or what have you. So that was a really engaging panel that we had done. And then most recently, we did a book discussion of Academic Ableism, which is a book by Jay Dolmage. And it was a small group. I'm thinking we had like 15 people in the discussion for that. But if anyone's familiar with that book, you'll know that it's not light reading. It's really, I'm reading the captioning here, sorry. It's really a dense book with a lot of history and contemporary connections here. And as we just started getting into this book club discussion, we realized this was way bigger than anything we were going to be able to discuss adequately in 1 hour. And some of the people who hadn't really thought about this topic of academic ableism in higher education, had said, this has already changed my outlook completely on the courses that I teach. And there were topics we had on our outline that we never even got to. And so what we've decided to do, and I'm probably jumping ahead to my next slide, is continue this conversation. But so we were busy. We did a lot of really cool stuff. We learned how to do things better. And one of my personal stumps is the narrative has been typically, well, we can't do that because of this, and it's too hard to do this. When COVID hit in the middle of March last year, we immediately went remote, we immediately went online, and things suddenly became accessible and possible to do that we had never thought, or perhaps many people had claimed couldn't be done. And I think one of the things this committee is really working on is how do we continue that accessibility, because this whole year has been an exercise in accessibility. But I think I'm going to talk about that more. I'm jumping ahead on my slides. We also have a website that's in development. Our Office for Equity, Diversity, and Inclusion, again, has brought this Committee on Accessibility under the umbrella. And through that, we are working on developing a bigger, better website presence so that that information is there. And then to the future plans, because that's my next slide, I think, we want to expand the minor. I teach in the minor, as Milo said. I teach the disability studies and education. My field is inclusive and special education. And so when this minor came around, I got to teach my dream class. And I'd like to grow the minor so that I can teach it every semester. Currently, I teach it once a year, and it's filling at 24, 25 students, and it's filling. We want to get graduate certificate opportunities, because what we knew and what is becoming evident is that this minor meshes really well with a lot of majors and a lot of programs. We'd like to see this go, more into part of nursing, therapeutic recreation. We would like to advise more education students into this minor, healthcare studies, counselors. So the word is getting out. I'll have a student take my DSE class by accident, because they're not in the minor. So I say by accident because they weren't in the minor, and they're like, well, I want to know more about this. Let me talk to you about the minor. So we want to continue to grow this. We also want to have ongoing discussions about best practices for campus events. Kind of in the beginning, we were more reactive to issues that we were seeing. Hey, did you know that there were no microphones at this meeting? Hey, did you know that there were no captions on this presentation? Hey, did you know? So we were playing catch up, and we still are at times, because sometimes something will happen and we'll say, whoa, that was totally inaccessible. But the idea is that we shift to a more proactive approach so that we can start educating people about these best practices. And so can we get to student services and campus services and say, well, when you want to do an event in planning, if you want to do an event, how many microphones? Because it's expected that there will be microphones there. So kind of working on educating people about how to do this the best that we can proactively. We want to continue to address campus accessibility issues. I kind of alluded to this already, that we are now doing a lot of online teaching and learning that we weren't doing before. People, myself included, who had said, I don't know that I could do an education methods class online. Guess who's teaching education methods online? And so how do we figure out how to continue doing this stuff as we evolve? Because it's a very ableist shift that we took a year ago. Because suddenly, when everybody being the non-disabled people, needed access, it was made there. And one of the things that I said Jess and I are working on is, how do we not roll back? Because that is a very intentional ableist move, to say suddenly we're going to cut off this access, we're going to cut this off. So one of the projects we're working on are, what are our COVID keepers, to use a phrase that Jess and I are working with and playing with a little. What are we going to encourage people, ourselves and our college community, to keep, because they are improving access? Financial sustainability, it's the icky topic of the year. We used to have a budget, and it was and now we have access to funds, and we are supported. But how do we continue this long term? We do have support for the work that we're doing. We have not yet, to my knowledge, been told no for something that we've wanted to do. But how do we make this an understood and expected part of our college community so that we are able to continue? And as I had already said, we're replicating the book club. we weren't done. We need to have at least one more, two more, perhaps this is a year-long book study to really look at ableism in higher ed, because if this is a new topic, we had to start out with, this is what disability studies is. This is what a social model, this is what a medical model is. Here's how you understand this kind of topic. And now here's how you reflect it upon yourself. So we've got great future plans, and we're all very excited about that.
Can I jump in on the financial sustainability real quick, just because I think this is an important piece, and Jess, please, feel free to say more about it. We did lose one thing. So in addition to just losing, instead of having like, we have this money to spend, now we ask things, we also had a stipend or course release for the person chairing the committee, which I think was very, very important. So we've got activist work to make our campus more accessible, more inclusive, more equitable. In order to do that work well, it's important that we do it in an equitable way, meaning we compensate the person who's doing the most labor around getting that change to happen. So we're in a little bit of a situation right now because of our, I'm just going to say financial situation. I don't know whether I want to use the word crisis or not, but I think everyone's facing this. Money is very tight. And so how do we continue to do good work without exploiting the labor of the person leading that work? And that's, I think, we're going to have a discussion in like 1 minute, and I would love to hear other people's thoughts on that.
Yeah, I'll just add really quickly that that I think will mean that the work of the chair needs to shift. And so that happened somewhat naturally this last year with COVID, because we just weren't physically there and weren't involved in some of the activities that we might be typically involved in, such as coordinating volunteers to assist with wheelchairs at commencement, right? Some of those things just weren't present this year. So I think, to Milo's point, some of that is going to need to be really sorted out in the coming year, and will impact the type of work that the chair in particular will and should be doing. Okay, so we were hoping to have a little more time for discussion. I guess we had a lot to say. So I don't know, Jen, how you want to proceed with this. I'll let you.
I mean, we have some questions posted. We're also really interested in answering your questions, because we may have struck some chords with you. So, I mean, I can start by, looking at some of these questions, but we will be looking in the chat. If anybody would like to pose a question, we'll just keep this very informal, and we'll react to the needs of the group.
And I'm going to put the questions from our slide into the chat. So if you just want to take down the PowerPoint, people should be able to access them in the chat, and then we can see if anybody.
Thank you. And we're also happy to have people either type in the chat or use the hand raise feature if they want to ask a question or make a comment.
So, I mean, we can just start this with that first question of, is work like this happening on your campus? Do you have, even at a small scale or a large scale, work that this resonates with?
Okay, there's a question in the chat. One of my colleagues has expressed concern about the language of some draft gen ed courses. Is there a way for somebody to intervene at that level? So I guess I'll start off, and then Jen and Milo certainly can jump in. The three of us have been involved a little bit in some of this work related to our, okay, and Nasli can help too, our gen ed language for what's called the D code at Brockport, the diversity code. For us, a lot of this work takes place in Senate, and Brockport specifically is going to have a committee in Senate that is really focused on having more of an equity, diversity, and inclusion focus. But I would think at our campus at least, and like I said, Milo and Jen, please feel free to disagree with me, is that some of that work is likely to happen more in the College Senate than in our committee, for example.
Yeah, we're, and I imagine we're not alone in this either, reconfiguring committees a lot. Committee on Accessibility is actually one that has stayed very consistent, but many of our EDI committees have disappeared or sprung up elsewhere. And as Jess was just saying, there's a new EDI committee that's going to be within Senate. I'm hoping that that committee and the undergraduate curriculum committee and the Gen Ed committee will all be in conversation with one another, and that will help. It also means we have to make sure that there's somebody on that committee that understands what ableist language looks like, which doesn't, isn't necessarily going to be the case. So I also wanted to add that, unfortunately, we haven't been able to do this in a while because of another funding and committee shift. But for a while, we were offering a 2-hour workshop training called Ableism and Accessibility. And we talked about what ableist language is, because I don't think it's something that people are aware of. And oftentimes when you first point it out to them, there's a lot of defensiveness because it's so deeply built into the ways that we talk and think about things. So I'm not sure if that was the specific language you were referring to, but I would also say this is part of our ongoing work for like campus education, is to get everyone more aware, rather than to just, if you tell someone to switch the language in their syllabus, but then they don't have the language going forward to teach the class, it's not necessarily going to have the impact that we want it to have.
Nasli, did you want to add anything?
Sure. I was just going to add that we actually discussed this. The SUNY Disability Services Professionals have a council, and we crafted a letter to submit some recommendations regarding the language. We actually were pleased with much of the inclusivity of technology literacy, but making aware that that should be inclusive of assistive technology and aligned with the digital accessibility policy at SUNY. And there were some things like someone mentioned in the chat about the oral communication requirement to try to modify the language to demonstrate various methods of communication rather than depending on a particular sensory ability. So we absolutely made those recommendations. But I think to your point, those kinds of determinations need to be made at the local campus level as to how they will be in the learning outcomes and things like that.
Mm-hmm. There was another question in the chat that I want to address really quickly, which was, is our work aligned with the SUNY EIT plan? And we are to some extent, although we're not responsible for that implementation or development, but we have representation from that unit, the Academic Support and Instructional Services, I think, unit, that we have representation on our committee. And in our last meeting, actually, they shared their proposed policy with our committee for review and feedback. So we're kind of working in parallel with them, both to try to encourage faculty to make their courses more accessible, and also to help review their policies and procedures so that they get feedback and input from us. I just want to also say thank you so much. I know the next event is coming up. We really appreciate your time with us today. I'll put my email in the chat if anyone wants to follow up via email. Milo and Jen can do the same if they feel comfortable. Again, thanks so much for being here. And we appreciate all of you. Have a good rest of your day.